Hey guys, welcome to our new broadcast from Mahajan Medical Center. Um, let's see, there is some issue streaming to Facebook. Let me see. Hi, okay. Um, I think one is going. Okay, let's start all over again. This is Dr. Mahajan from Mahajan Medical Center, and we are very excited with a new show today for technology and medicine, especially which has improved the lives of the patients, like patient portal and mobile apps. And we got a very exciting guest, good friend, Parul Garg, and we'll introduce her in a minute. And we got our uh, very friendly and fantastic office manager, Debbie, and our lead MA, medical assistant, Jen, who does case management as well, on the show too, to demonstrate different pieces of the technology to help you understand where we can use it. For the folks who don't know me, my name is Dr. Mahajan. I'm a board certified internist practicing in Largo, Florida. I've been in practice for 26 years now, time flies. And, I go to local hospitals, Mount Plan, Largo Medical Center, and we do a monthly webcast, and we introduce different, uh, brilliant minds and people who have done phenomenal in the field. And we're very excited that we're going to have our friend Parul Garg representing one of them today. So let's have a brief introduction about Mahajan Medical Center, and we'll get Parul on board. At Mahajan Medical Center, we care to listen to our patients. Proudly serving the needs of Tampa Bay in primary care for 25 years and counting. Hi, thank you for watching this video. We're going to get Parul on board now. Let's get her on board. Hello, Parul.
Hello, Dr. Mahajan.
Thank you for coming, and I know you're very busy with running a company which focuses on um, billing cycle and physician billing and big groups. And you got a big operation here in United States as well as in India to support operations. Tell us about your journey, how you've been, and how you came to being such a successful businesswoman.
So, thank you for having me on board, and I would like to thank you, Dr. Mahajan, for giving us the opportunity. You were actually one of our early onset clients, and 15 years, over 15 years have passed by. It has been an amazing journey, not just with you, but many physicians like you, who support us in the business. We support you, and the friendship we share. So a very thank you to you. Me and Kunal, we started this business practice forces here in Clearwater, Florida in 2003. And since then, we have onboarded many practices like you. We are here to help physicians and of course the patients.
Great. That was a great introduction, Parul. And let's introduce the material you're going to present today. Let's have that. All right, so it talks a little bit about Parul. She is the owner and vice president of the revenue cycle at Practice Forces, a local company out of Palm Harbor, Florida. Very bright, uh, business leader. And she has been a certified coder along with running the operations. And they have operation, as I said, both in United States and India. And she just mentioned we've been together in this partnership with them for 15 years. So these are the topics she's going to cover today. The part one, she's going to talk about telehealth. I know a lot of you folks use telehealth to communicate with us during this COVID era, and it has been a beautiful way to interact with people without worrying about getting COVID-19 from public places. I think I'm glad a lot of insurances, including Medicare, has continued to support telehealth, and Parul will tell us whether it's here to stay or not. Hopefully, it does. And then we got our lovely office manager and lead medical assistant Debbie and Jen going to talk about Healow app, which is the app with the clinical works, which you can use on your phone, and they'll go over how to download and how it's what are the advantages of having it, and it's free. I like free. I don't know about you guys, but free is good. Um, and then we're going to talk about the surprise billing. Some of you folks may have seen when you go to emergency rooms or surgeries and you get bills from anesthesiologists, radiologists, and they're out of network, and it's very high bills. So she's going to talk about the new federal law to protect the consumers. The last piece is very near and dear to me is importance of mental health, and June is a mental health month. So I'm going to, depending on the time we have from these topics, we're going to touch on that. All right, so let's start with the telehealth, and let's see what Parul has to. All right, let's see. Let's get you Parul on board. All right, Parul. So tell us, telehealth. Is it what's your experience has been? I know you manage a lot of physician practices throughout the country. How has that helped during the COVID-19 pandemic?
So we can't, as we all know, March 2020 was the hit when pandemic started. And that was the time when CMS initiated and said telehealth is open for all physicians across the board. You can see patients from Florida. Florida providers can see patients in California. And because of the shortage, I think they opened everything. No rules are there yet to close it, and it looks like telehealth is here to stay. Of course, we are hearing about some telehealth attestation that government will be asking the providers to do, attestation certification. So I'm sure if they stay, they will tighten the rules little bit. Right now, telehealth is open. You can do it through FaceTime, video call, audio call, everything is allowed. But I'm sure if they are leaving it open, they will tighten the rules more. I remember last year when they started the telehealth, how crazy everyone was. All medical practices were in a panic attack to figure out how to utilize technology, how to see patients, but not call them to the office. So it took almost a decade for Medicare to introduce telehealth, and pandemic was the time when it all kind of fall into place. So it's a boon. I have also heard from physicians, and Dr. Mahajan can share his experience as a physician. How do you like, Dr. Mahajan, telehealth? I guess it's like everything; it has its own good and bad.
Right. So the telehealth, I think, is very useful for, let's say, someone having cough and fever and you don't want to get them out of the house, especially in pandemic when you're not sure whether they have COVID-19 and you don't want to give it to any employees in the office or any other patients who are in the office. So that has worked well, but it has this limitation because not everyone has great cameras or great know-how to use the technology tools. And the sense you get from examining a patient in the office is a very unique sense, and it's hard to replicate that for a lot of conditions through the camera. So yes, it has its value, and I hope they keep it as another tool for something like simple like UTI, something cough and cold, something quick. But if they're having chest pain or chronic condition, lab follow up again. That's a unless it's something not anything abnormal and you need to follow through on any testing in the office. That's again a good use of telehealth. I have some
Mm-hmm.
patients who come from, Riverview, Brandon. I have a patient who come from Fort Myers. So, and our patients who are snowbirds, and now they are using it when they are going to Michigan or Illinois or Massachusetts or any place. So the distance has become immaterial. So, for refills, let's say, and they had the blood work done, they just need the refills. I think
Mm-hmm.
that's good for that. So, it has its pros and cons. Let me introduce Debbie and Jen, and they're going to show a little bit about how to do a telehealth visit. It's very easy. So, a lot of seniors are afraid of technology, and Debbie and Jen going to show us how to do it. All right, let me get them on board. Hello, Debbie. Hello, Jen.
Hi,
Hello.
everybody. So we're going to
All
show
right,
you
so
today what happens when we send you a text message and how you will go ahead and get onto the Doxy website and do a televisit with one of the providers. So in our office, we'll go ahead and send you a text message. So I'm just
but
going to show
before
you.
we do that, Jen, I know you're nervous and you want to get it out of your chest, but I want you to introduce Debbie, your boss first properly.
Okay, so this is Debbie. She's the office manager here at Mahajan Medical Center. And you should know me. I'm Jen, and I'm one of the lead medical assistants back here. And I also work on the CCM program and case management.
All right, now you start.
Okay. So Debbie has sent me a text message, and I just want to show you on here what it's going to look like when you get it on your phone. So we'll say Dr. Mahajan has invited you to join a video call. Very simple. So all you got to do is click the link, and it's going to bring you here to the Doxy website. Oops, sorry.
That's okay.
Okay, and then you're just going to check in. So that means you're just going to put your name in there so we know which patient you are. Okay, and then we're just going to hit check in. And then this will be the waiting room. So it says Dr. Mahajan's available. So then we're just going to wait for the doctor to get on to the room. So you're probably going to have to go out to eat.
All right, let's go a little bit slowly. I know you're going too fast. All right, let's go a little bit slowly. So let's say, I want to make an appointment with Debbie, for example. So I call the office and say, hey, I want to see Dr. Debbie today, right? And then you say, okay, I'll send you a link, correct?
Okay, yep.
Yes, okay. And then you send the link on there. You say, okay, you have a phone. So they need to have a smartphone or a phone which can take text, correct?
Correct.
And has a video.
Has to have a camera on it.
Right. So let's just talk basics here because a lot of senior folks struggle. So they need to have a camera, phone, and they can take text, correct? Because a lot of them have flip phones, so that won't work with flip phones.
No, unfortunately, that won't work.
Okay. So, folks, it's good to invest in a smartphone, if you want the televisits, or more importantly, if you want to look at your labs, which they're going to show you in a minute as well. So, smartphone with cameras are become very cheap now. You can get the older versions of the iPhones or the Android, whichever you prefer, and they're not as expensive as they were before. And once you use it, they are great for taking your selfies and sending it to your grandkids or whatever you want to do. So the smartphone is number one piece of equipment they need. And then you send them a text, hey, you're invited, and then you take over from there.
From our end, it looks like this. So we'll send you a text message from here. And then you'll see where Jen showed you that she received the text. Now Jen's in that waiting room. So we'll just click on her.
All right, so you
now we hit start call, and then it will connect us to her phone.
They still need to pay their co-payments, right?
Correct. They'll work you up just like they do, but instead of being at check-in where they collect your copay, then one of the MA girls will either bring you up front, collect your copay over the phone, and then we'll go from there, and they'll continue to work you up as if you were in the room with them.
So they need to have a form of payment if they have co-payment available through credit card, correct?
Correct.
Yes.
Okay. So it's very simple, and then minute we click OK, and they can see us and we can see them, correct?
Absolutely. And then it's very simple from there. And then it says the video session will start soon. Now we are in the same room, so
I'll walk out.
So then on my end, I'll be able to see a picture of the doctor, the provider that I'm seeing.
So we got Dr. Debbie there now.
I'm doing well, Debbie. Thanks for being able to fit me in today.
No problem.
And then Debbie will have a picture of the patient or you on her phone. So she'll be able to see if you have anything you wanted to show the doctor, a rash or something. He'll be able to see that. And we can also take pictures as well.
All right, great. So, that's a great demonstration. Let's get you, Parul, back and get out of here.
I want to add.
All right, let's get them. Okay, here we go. All right, Parul. So do you want to? So that's one way, and the other way is a direct FaceTime as well, and that's also considered televisit, correct?
Yeah, initially it was, and I think the government right now is not too crazy on the rules and stuff. We have not seen much audits on records for telehealth charts, but time will tell where it is going. Looks like it's here to stay. The insurance companies, especially CMS, is extending the telehealth every 90 days. So we'll see July 1 what is the new update coming forward. As the cases are going down, it looks like even though pandemic, I don't know if we'll come to an end or what, but telehealth will be there. I want to share a very important data. Before the pandemic, telehealth was allowed for rural facilities, and the data was in a week all over the country, about 10,000 patients were seen as telehealth. And since March 2020, every quarter, there are more than 10 million patients who are getting services via telehealth. So that's amazing, change using the technology. Yes, some patients are not as, like Dr. Mahajan was mentioning, the phones and stuff, but definitely the update that the providers have done, the patients have done, utilizing the technology for medical reasons, have really seen a lot of changes in all countries around the world. People are now using telehealth. Don't run away from telehealth.
Yeah, so hopefully, we will have telehealth in one way or another. Now people are getting used to it, and we know the limitation and advantages of it. So, hopefully, the insurance company realize that and keep that reimbursed. So let's go to the next topic. You want to talk about the role of patient portal in the how it fits in, and then one of the part of the patient portal is the Healow app. First you need to be in a practice and enroll in a patient portal, and then you get enabled, and then you can download Healow app for our EMR ECW. You want to talk, Parul, about the benefits of Healow app?
Yeah, so to the patients watching this live show, I want to encourage patients to use the technology again. It's there to help you out. Of course, if you download the app, initially there will be little hassle, but the offices have all these good people like Jen, and Debbie to help you out. So utilize the help and download the apps, because it's all helping to connect you and your providers together on your phone. We encourage patients before
And
they
then,
see the doctor. Mhm.
they can, so for summary, let's give them a global view, Parul, if you may. They can access their records. So we have a lot of snowbirds,
Mhm.
and they go up north and they see, providers there. So the labs and the imaging, if they interface with our patient portal, they can show it to the providers up there. They don't need to carry the physical records. To me, that's a huge
Exactly.
advantage if you are
Exactly.
traveling. Yeah.
Mhm.
And then the other piece, which I really think benefit the patients quite a bit, is the the prescription refill. So all your prescriptions are there, all your meds are there on your phone. So let's say at 10 o'clock you just remember, oh, I'm taking my blood pressure medication, I got 3 pills left. You don't need to call the office, because we'll be closed at the time and the answering service won't do the refills. But if you have the app or the patient portal, you can request a refill, and then next day you don't need to call. It will be automatically sent to the pharmacy, and you will have the medication available next day. So that's huge that you don't need to call. It's good for the practice too, that we don't have additional call volume. But we don't mind getting that call, but it's win-win, because next day you may be busy doing something and you forget again, and then it's end of the day again. So if you have patient portal, you can use it for refill. So I think that's huge. And the third piece is billing. You want to
Mhm.
talk a little bit about the billing on the patient portal, Parul?
Yes. So if you want to see your records, know how much you owe, what you have paid the office, everything is on your patient portal. Try to utilize the patient portal as much as you can. It's there for you and your education. We definitely will encourage the patients to use patient portal. And any
Great.
way we can help out will be, let us know.
Yeah, let's bring our friendly neighbors, Debbie and Jen, to demonstrate how that works. Uh, all right, let's get them on board. You girls are back.
Yeah, we're
Okay,
here.
hello.
So you want to demonstrate patient portal first, and then Healow app, how the different features are. Jen and Debbie, you ready?
Yes.
Yep, we are.
Okay. So this is what the patient portal login screen will look like. And you'll just put your username and your password here. And then we can click login. So say you
let's
lost
just
your
back
account.
off, Jen, let's
Okay.
just back off. So let's say I'm a new patient, right? I'm a new patient, and I never been to Mahajan Medical Center before. So how do they, get access to the patient portal? Can you tell patients that, please?
Yes. So when you check in at the front desk for your appointment, they'll ask you if you would like to be web enabled, and we will get your email address, and the girls will giving you a temporary password, and then you'll get an email link, and then you have to change your password within 24 hours and log on to the portal. And then
So
you
it's
should
very
have
simple. It's very
Very
simple. They just need to have an email. So for senior folks, let's just break it down for them. So they need either iPad or a web-enabled device. Could be a tablet, could be a laptop, could be a desktop, correct?
Yes.
And then they also need a working email, right?
Correct.
And if there's husband,
Dr.
wife,
Mahajan, a lot of our patients are couples that come to the practice. So it's important to note that they would each need their own email address to access their account.
yeah, that's very important. That so if I have my wife coming into Mahajan Medical Center, we both need separate emails, so there is privacy for
Correct.
each of them. But a lot of folks up north, if they have kids up north, they can give their email, and they can, as long as we have healthcare surrogate paperwork in the chart, they can give it to their kids, correct?
Correct.
So that's a good tool for a lot of folks whose kids are more technology savvy, and they want to monitor their parents' appointments and lab visits. They can do it from anywhere in the country or world, for that matter, right?
Yes.
Okay.
Very
All
convenient.
So go on with your show now. I'm sorry I keep interrupting you guys.
Okay. So once you log in, this is what your dashboard will look like. So it'll have your appointments, any messages that the provider or the office has sent you, and also your current medications.
Oh
And as
boy,
you can
Jen,
see-
you're taking Aricept? I
Yeah.
thought you-
And you know what? I'm going to need a refill on that.
Oh my God, you're going to need a refill?
You can
I
refill it
thought
right
you,
I can just
now I
refill
know
it
your
right there
secret
on the
for
portal.
knowing everything. All right, so how do you get refilled? Show me how do you get refilled?
Sure, very simple. So right here, yeah, thank you. So right here, we're going to click request refill. And then it takes you right to this screen. So we get it focused. Got a glare on it. Okay, there we go. Got it, Debbie. Okay, so there's the medication. You just want to confirm that that's your medication and the dosage that you're taking and the one you need a refill on. You're just going to check the box like that and then request the refill. And then now it's going to ask you which pharmacy you would like it to go to. So if you just click here, you can enter. So we'll just say I want to go to Publix. And then it brings up all the different Publixes. Okay, so then we'll just choose the one. We'll choose the one closest to us.
While you're doing that, let me talk to Debbie. Debbie, on the patient portal, the other thing I saw there was messages. So, that's a great tool for patients to communicate with the providers or the office staff for non-urgent emergent issues. How you see our patient using it effectively?
They use it quite frequently. So each there's a few members of the team that are assigned different jelly beans per se. Your prescriptions will go to an MA to get refilled, or they may come to me. General messages will come to me, and they like to communicate with the nurse practitioners and with the doctor. So I'll forward those messages to those providers, or I'll help them if I can myself and send them back. So we go back and forth through email messaging quite a bit.
So that's a great tool for, again, if the families are far away, Debbie, and their daughters, granddaughters, grandsons, sons, want to find
a lot
out
of times
about,
the family members are the ones communicating for the patient.
right. And we do have a lot of seniors whose families are very involved, which is good. So that's a great tool for them, but they should not use it for any urgent emergent issues because, for that they need to
It may
call
not
the
be
office.
answered immediately.
Right. So it's more for general queries and things like that. So they don't need to get on phone and wait for someone to pick up, and then, for us, it's fantastic. We can look at it and assign it to the right personnel, correct?
Yeah. And we get back to them within 24 to 48 hours.
Yes, I know you guys are super efficient. So we talked about med refill. Jen talked about it. You talked about the use of the messaging for, and then there is Parul talked about that they can pay their payment. Do you have something you can show that you can make their payments through the portal?
Yep. You'll statement when you go into the portal, your statement will show, and you can just click on the statement. Jen's bringing it up now, and it'll say, you can click pay now, and then a box will open where you can enter your credit card information. It's all completely secure.
Mm-hmm. So on your dashboard on the side here, you have different options. You go to My Accounts, and then you can see your past statements, your current statement. So I'm going to click on Current Statement, and let's see. I do have a bill right here, $5.
We'll take it out of your salary, Jen. Don't worry.
Okay. Up at the very top, it makes it very simple for you. See the box right there? Pay bill. Just going to click that. And then it'll take you right to the screen where you can put all your card information in.
So it's very secure because there is no other parties involved. It's right on the server of the software. So it's so that's pretty neat. So they can see their statements, previous statements, so they know why the balance is from. So that's good.
Mm-hmm. the dates of whatever the bill was.
Excellent. And I think I saw the day a patient in my office, and they came with their son who was on the phone, and he was saying that he saw some duplicate medication. I think Patient Portal and Healow app is a fantastic way for if they're getting prescriptions from different sources, let's say cardiologists or GI or whatever, and from us, and their duplicate medication or something they're not sure about. And it's a very good tool because ECW, if they take ECW, the other practices, you can have multiple practices attached to both the mobile app, the Healow app, as well as the patient portal, correct?
Mm-hmm. Yeah.
Yeah.
So,
You would
so
have
they,
a different
if
login
they
for each
different,
practice.
say it again.
So you would just have a different login for each practice, but there are multiple practices are attached to it.
Mm-hmm. When you first get onto the Healow app, we'll show you too that you just choose your practice. You choose your doctor's office. And if you don't know the practice ID, it's easy to search.
Right. Anything else you want to show on the portal, Debbie and Jen?
You want to show the records so they can see, do we have something in there for you?
Right. So that's another great feature is, how to look for your own records, which is very, very useful if you're coming for follow-up, with your provider. You look through your labs already, so then you can analyze what is abnormal or what's normal, or if you can understand that, then you are ready with your questions, so you get more from the visit.
Mm-hmm. So I just wanted to point out too, on the dashboard, it will show any upcoming appointments that you may have right there, and then along with your messages. So I do have a message, and it's just letting me know that I have my appointment for tomorrow at 12:30. So extra way to remind you.
You can also communicate from that area also if you'd like to change your appointment or cancel it.
Mm-hmm.
Yeah, that's a good idea.
Okay. So there is.
What
You can
you
also-
going to show now, Jen?
Yes, I was also going to show. There's also a screen on here for you to put in immunization. So say you went somewhere else and had a shot and you wanted to add it to your record.
Oh, that's a great feature, Jen. Thank you for bringing it
Yes,
up.
so that's very simple, and it's all right there. You just choose the vaccine that you had and the date that you got it.
Right.
So that's a great tool.
Yeah.
And then also I wanted to point out that when you're in the office and Dr. Mahajan or one of the providers tells you that, go check your portal, I've sent you some education. There's a patient education slot on here as well.
And Jen's got some education in her chart.
So we're just going to click on that. And then here's what the doctor has sent for me. So helping.
Yeah, I'm glad you need help with Alzheimer's for sure.
I know. So you can just click that and it's always going to stay there so you can access it whenever you want.
I think that's a great feature, which is we are using for the last 15, 20 years, patient education. And what I like about doing it on the portal is, as you rightly said, if let's say someone has arthritis of the knee or shoulder or whatever, and we give them exercise, they do it for a day or two or a week, and then they lose the paper if you print them out. But if it's on the portal, it's always there, and they can, let's say if they have an iPad, and a lot of people have tablet or iPads or phones, and then they can just put in front of them and they can, while they look at it, they can do it. So it's very good for exercises or for anything, which is a recurring condition. Let's say today someone came in with high blood pressure and gave someone a, patient education for DASH diet. And you should ask the provider too, as a patient, when you come in and say, hey guys, can you give us some education? And then, follow through, read. More educated the patient is, more compliant they are, and longer they will live, and it will help my kids go to college. All right, so let's get Parul. She's getting bored, and we'll get her to talk about Healow app, and then we'll come back to you to give a demonstration what it is. Hi, Pearl. We didn't mean to ignore you,
No,
but the
no,
girls are.
it was a great presentation. Jen and Debbie did amazing, and we all we can suggest our patients is, the technology is here to use for you, for your use. A lot of rules are changing as far as patients accessing medical records and all that stuff. So it's good to see, our practice has already implemented the changes. You have access to your records, to whatever you need is already there. Just use it, and it's all good.
Right. So you want to talk a little bit about Healow app or the mobile phone app. It's a mirror of the patient portal, and there are some less features than the patient portal, but it's more mobile, right?
Right. It's more mobile. In a Helo app, I can see all my providers' appointments, everything that's going on with my medical history, with my providers, in one app. It's all connected. So it's a very good use of technology that, these developers are utilizing for the patient's needs, to connect the doctor, patients to all their doctors. If I have an allergy, I can document in there. So next time when I go to the provider, I remember what and maybe if I'm going through, in old age, I'm going through dementia. It's useful for your, the caretaker to inform the providers too. So it's a good document of history, of your own history.
Right, and then you can have multiple provider, as I pointed out, if they use ECW in same app.
Mm-hmm.
So then the information, different appointments. So as you said, it is all in one place, and a lot of providers do use ECW. The only problem is there are a lot of different softwares out there, and I hope they start connecting quicker. They are talking about interoperability, and it is better than where it was, but still, it's not. If you go to LabCo, let's say, and they have their own portal. You go to Baker, they have their own portal. You go to Mahajan Medical Center, they have their own portal, and I think that's the complexity for the patient to negotiate. But at least they have access to the records, which is, as you rightly said, is wonderful. You're going to talk a little bit about. We'll have Jen and Debbie give the demo on Hilo app in a minute, but let's get your piece out about how the new law is shaping up, or is already in place for out of network or surprise billing. You want to shed some light for our patients on that, please?
Sure. So good news for the patients, and we like it, how I think even us as a patient, when we though we work in the medical field, but when we go to hospital, once you go to the hospital as a patient, you pretty much are screwed up with the bills. So this new law that's coming for surprise billing is protecting the patients. And it's good to see how lawmakers are thinking about general public. We all pay our insurance premiums, but when it's time for us to get the care, we get the care, but then we end up with the bills. This new surprise billing law, which is expected to start from January 1, 2022, which is, in next 6 months, is there to protect patients from those surprise bills. What we know so far about this new law is it will protect patients from those unanticipated care for out-of-network physicians. When you go to the hospital, as a patient, you really don't have any control on who comes and visits your room, and then sends you a bill. So this is basically protecting the patients, and hopefully you won't get those extravagant bills anymore.
Yeah, that's great, Parul. I think I'm glad the federal government is thinking from patient shoes, and it's so complicated, the healthcare. You go to, emergency room and you have a medical emergency. You're not thinking about whether the emergency room physician going to be out of network. That's not fair to the patient. They can look at whether the hospital is in the network, and everything else should be flowing in the network. And now, the anesthesiologists are not, and how do the poor patient know? So I'm glad the federal government is doing something about it. Let's go back to Jen and Debbie and have them demonstrate Healow app. Let's go there to those girls.
Hello again.
You guys are back, so you want to show
Hello.
how the Healow app works?
Yeah, Jen's going to start from downloading the Healow app from your app store. And then while that's working, I'll show you how it works for mine.
All right, go ahead.
Okay, so this is an Android download. So you'll go to your Play Store on your Android. And I've already typed it in. So it's Healow. And we're going to click on the top one right there. eClinical Works, okay? Go ahead and install that. So it's starting to install. And while that's installing, we're going to show you on Debbie's phone what it looks like.
So the Healow app is free, so you guys don't have to worry about any cost attached to it. So that's a nice piece.
Right.
Yes, it's free in both.
Once you get in and you get your login, you'll have a 4-digit PIN that you're going to have to use to get into it. So anybody who has your phone can't just get into your account.
So that's good for patient privacy, you know.
Correct. And then you can personalize it. You can put your own picture in the middle there. And then you can see the different things that you can look at, whether it be your records, your appointments, the same thing. I think you can do everything here just like the portal, except right now we're not able to take payments over it.
Right, so they can look at their medications, they can look and do the medication refill as Jen showed from the patient
Correct.
portal. They can message, they can look at their appointments. And anything I'm missing?
Okay, so I just wanted to show you this really quick, easy way to view your medication. So you're at another doctor's office and you're not sure what you're taking, pull it right up on your app. You can tell them exactly the medications and the dosages and how many times a day you take it.
That's a great feature, Jen. I'm glad you showed it.
Yes, and also another thing, so say that doctor decided he wanted to change your dosage of medicine. You can edit it for it right here. You can edit it, and then it sends a message to us saying that you edited a medication. And then we just have to confirm it.
You know, Ray Davis is saying that you both are good guests.
Oh, hi, Ray.
Hey, Ray.
And Carolyn, hi.
Hi, Carolyn.
Okay, that's a really great feature. And then it also you can also see your medical records on here, which is what everyone loves to see. So right here, let me show you where I got there. Okay, so we're back on the wheel, and you're just going to go to the medical records. Oh, hang on. All right, here we go. All right, so Debbie doesn't have any vitals in her chart, but this is what it would look. Oh, there she does. Okay, so this will be the last vitals that you have in your chart. So you can check to see you forgot to write down your blood pressure that we took earlier. You can see it. You can check your allergies. So if you're at another doctor's office and you want to tell them if you have any drug allergies, there you go. What else can we do on here?
Show the labs.
The labs, yep. And lab results.
All right, so let me point out here, the labs are very fantastic because, you know, as I said, there is disjointed portals. So that means, let's say your rheumatologist did a cholesterol on you, for example. Now, I don't want to do it again, but I don't have access to that lab. But if you have access to that rheumatologist portal, you can show it to me and I'm good. You know, I will say, okay, I documented your cholesterol was good. I don't need to do it again. So it helps not to duplicate things. It helps the other providers to know what the other providers are doing. So I think having it in your hand, in my opinion, is very, very useful for continuity of care. So you can go from one provider to another provider and show them the labs without carrying a big folder like olden days. A lot of good folks used to keep it, you know, big folder, and then they use it for weightlifting after a certain point. So, so let me show you.
Yeah, this is what the labs come up as. So they're really nice. It's pretty much the same view that we see in the office. So you can see all the results right there, and also the reference ranges to the side.
And then the abnormals are marked red, correct?
Yes.
Low and high.
They're red. Debbie.
Debbie, you need to.
Can we
eat
show
more
some non-red
plant-based
ones,
diet.
please? Those are old.
So it's great.
Okay,
It's got all of them in here. So all your labs would be in here. So you could choose any date. So just chose another date, and there it is. And there, Debbie, you don't have any reds on this one.
Okay, good.
So that's really great. And then let's see. You could also look at your immunizations on here to show your other doctor under the immunization log. And that's going to be all right back on your My Records. So all these little fun buttons down here, lots of different things you can do. Oh, and another great thing is also you can send messages to the office. So
The same way as the portal. We'll receive them the exact same way.
So messages, and it goes right to the office manager. So it goes right to Debbie. Okay. And now my app is ready, so I can walk you through what it looks like when you first get onto the Healow app. Okay, so I've opened my app. So this is what you're going to look like when you first get on there. See, it says, it's got your little wheel, and then it says get started at the bottom. It's really simple to set it up. So then you're just going to put your name and your information in. Let me do that real quick. Okay. And your date of birth. Okay. And then it's going to ask you about if you have a practice ID. Now, if you don't have a practice ID, it's okay. We can find it. So I'm just going to say, no, I don't have one. So then we're just going to search for one. Very simple. Just put Dr. Mahajan's name in. And you're going to just put in the zip code. And hit search. And it's going to say. And then we're going to hit search. And it's going to search for him, and you can see him right there, Dr. Mahajan and Dr. Mira. And then we'll just click on it, and then it's going to ask you to verify. Is this your practice? And if you recognize this, which you will, then you'll say, that's my practice.
That's very simple.
Very simple. And then
yes.
this is the login. So then again, you use the same login that you'll use for your portal. Okay. Then it's going to just ask you to agree to the terms like you have with any online app. Okay. And then that's it.
And then you can personalize it with your picture from there and review everything that's in there from the practice.
That was very easy, Jen, and everyone should be doing it.
Sometimes it might ask you to verify with the text. So then you just make sure that that's your number, and then you just send the text, and it just wants to verify that it's you.
No, that's important too.
Yes, very important.
Mm.
And then see how quickly I got that message on my phone for my verification. That easy.
All right, so that should not be very hard, and we can help them, to if they're having any difficulty, and they can come to Stephanie and Jen and.
Yes. So if you get locked out of the account, you just call us and we can reset your password. This screen right here is what Debbie was talking about. This is where you'll choose your PIN. Right. So just the 4-digit PIN that only you know, so you can access your records on your phone.
Right.
And then you just got to confirm it. And some phones actually will let you sign in with your fingerprint too, if you have the capability for that.
That's
we're going to skip that for now, but that's something
you
too.
Don't have to use the PIN.
Yeah, so then you could just use your finger to log in.
So, one of our friends chimed in. Let's see what she's saying.
She's talking about my labs.
All right. Okay.
And
So
then
do you have
here's
any
the
other
screen.
feature?
Yep, this is the last step. Once you have all your information there, and it just says at the bottom, complete enrollment.
All right, good.
So simple.
So, yeah,
Congratulations, you have enrolled.
all right. So, I think everyone should get a smartphone if they don't have a smartphone. And, and next time they come to our office, ask one of the ladies, MAs
we'll
or
definitely be
front
glad to
desk,
help you get set up.
and we can get it set up. It should not be that hard. And once you start using it, you will say, gee, man, I should have done it a long time ago, because it's so useful for your patient care, for continuity. If you, God forbid, end up in an emergency room away from here, and, as Jen was showing, you need to show your meds, and sometime in a panic, you don't know what you're taking. It's very simple to put it up on your phone and say, these are the meds I'm taking. These are my last lab. These are my allergies. These are my vaccination. So they don't need to keep giving you the pneumonia vaccine over and over again. So
Exactly.
that's all good if you can use that. All right, let's get Parul back. Thank you, ladies. For do you have anything else you want to add before?
I can just show them real quick that when the first time you log on, it does give you little tips. So it shows you little things to do on the app. So in case you forget anything I said, you can just access it right here. Couple different tips for you. It tells you how to navigate through the app.
That's a good idea to you look at those tips, because they keep adding new features which sometimes we don't even know and patient teaches us. So
Yeah.
This technology is evolving and improving, and I think is the way to the future. And once we add some more features like remote monitoring to the Healow app, I think that'll be phenomenal. If we can follow their weights, their blood pressures, that'll be great. If you look at what Ray is saying, and I think that's a phenomenal use of these apps, and the patient portal is checking his labs, and and that way he knows whether I'm going to yell at him or not. All right, thank you so much, Jen and Debbie. Do you have anything else, or should we go back to Parul?
Well, if you do have a smartphone, a smartwatch, there is a tracker on here that you can track your activity on.
Oh,
So
that's nice.
it's pretty nice. So it's under trackers, and then
like
they have
Fitbit.
certain
like
Fitbits
Fitbit.
on here. You can buy them, or you can set up one that you have, and then it'll help you track your steps, your distance, your calories, and your BMI, which is great.
Wow, so you can do all at one place.
Yeah. So it's very nice.
All right, give it back to Debbie. She needs to put her tracker.
The track you, Debbie.
All right, girls. Thank you so much. That was so informative. I think
Thank you.
patients should use more and more. I think we have, and I'll get Parul back, and we have one of the highest acceptance in terms of the patient portal, but can we improve more? I think for sure we can improve more. All right. So Parul, we covered, let's have a quick overview. So we covered technology in the offices which patients should use, and it's for their benefit. It's free, which is patient portal, which is through the laptop, iPad, or desktop. And then the same technology could be used on a smartphone for same features on the Healow app or any other apps. Healow is just a proprietary with ECW, but other software has their own apps. So patients should use it if they go to see a specialist. I wish it become more common apps, but I think it's coming eventually. But more we get comfortable with it, more is good for patient, continuity of care from one office to another, from one ambulatory setting to hospital or emergency room setting. Anything else you want to add? And you talked about the federal government going to come up with January 1st next year with more um, clarity on out of network and surprise billing. So that's going to be a relief for the patient. Anything else you want to add to what we just discussed so far?
No, I think you summarized it very well, Dr. Mahajan.
All right, so let's just talk about our relationship and how you have helped us, and and hopefully we helped you in some way. And I think we started 15, 16 years ago. You guys started managing a billing, right? Somewhere in that ballpark.
True. Yep.
And we come a long way, and you come a long way too with over those time. And your operation has grown bigger and more smoother, and so has ours. And so that's fantastic to have a partner like you. And you manage a lot of other practices other than primary care too, like anesthesia, radiology, all different specialties, correct?
Yes, yes. We pretty much have all specialties under our belt. We specialize in anesthesia billing. We help large anesthesia groups here, in the country. We help single physicians, multiple group, big groups, surgery centers, so all kind of specialties. We have about 25 plus employees in our Clearwater office and about 400 employees in our India office.
Wow, I didn't realize that you have that many in India office. Must be, a lot of work to coordinate between those two operations.
It is, but it's fun. It's fun to help people out.
Great. And I think you guys have come up with a lot of good solutions over the years in reporting, which we have been benefited from in terms of data analysis, Excel sheets of getting reports, which the standard, the software like ECW does not give you access to. So I want to thank you for coming up with special reporting for our practice.
Thank you, Dr. Mahajan.
All right. So do you have anything else, good wisdom about technology to add, or should we jump on mental health, and since it's a mental health month?
Yes, I think we can jump on to the next topic.
All right, so let me ask you this. I know you run a big operation now, 400 in India and 25 here. So how's your employee coping with COVID in last 1.5 years with mental health, with with working from home and all that?
We have been lucky enough to have employees, who are open to join to work from office. Some employees were given. I mean, most employees were given the option to work from home. Some even tried, but they just didn't like it. Coming to the office, and us being one of the essential services, we were pretty much open all the time. I think mentally all across the globe, we know mental health have declined, and people are struggling.
Yes. So it's a good point. And a small business like us, we were open throughout the pandemic because we have to take care of the patients. And from the provider perspective, from employees perspective, it's been a challenge because they have to take care of the patients, whether they are sick or their families are sick, or so the healthcare workers, you got to give them a lot of kudos, not just in our ambulatory setting or billing RCM management, which is important to keep the head above water for the practices, but also hospitals, nursing homes, a lot of nurses, CNAs, MAs, they and the transporters in the hospitals, they took the brunt. And the problem is that it's not ending. It comes in waves. Right now it slowed down, and you get a little bit of break, which is nice. But unless people get vaccinated, unfortunately, we are going to see scenes from New York or Italy or, God forbid, India and United States in the pockets. For example, San Francisco, Seattle has done a fabulous job with vaccination, the 80% plus, close to 80% plus. And, small cities, rural areas, they're hardly up to 20-25%. So we're going to have a big disparity this time, unfortunately, in the second wave with the newer strains like Delta plus viruses. And it's just a matter of time, when the weather cools down, and it's just so. We'll encourage everyone. I know you got vaccinated, and I got vaccinated, and your family got vaccinated. So that's fantastic. So I need to do it for you, and you need to do it for me. We need to do it for the whole community to
True.
prevent scenes like what we've seen in India and Uganda in Africa is going through same situation, and I think it will come back here with vengeance. And I hope not. I pray not, that people use common sense and get both doses, or if they're going J&J, they can do one and done dose too. So I think vaccination is key. Let's go back to mental health for a minute. The kids. I know you have 2 children, and I got 2 kids, and we seen them go through virtual school and not socializing. How's your kids doing?
I think the kids have, I mean, not just our kids, all over the world, kids have suffered. They don't express, but it's like a PTSD syndrome, right? I mean, these words are not just for wars or for some 600,000 deaths in just the country. Those families who have lost their near dear ones, kids seeing their grandparents dying, or neighbor dying. I mean, it's affecting, and them attending the virtual school, being in front of the screen all the time, it's definitely affecting.
Right.
We
Pinellas
will
County and
the
Pinellas County, next year they're going to have only physical schools. I think that's a brave step, but the step in the right direction.
Definitely. I think our healthcare workers, nurses, teachers, all these social workers, have helped so much the whole society and community out. We don't thank them enough. We don't realize, but all these people, they have stepped up and put their lives in trouble to help us and our families.
Right. And it's been fatigue. That's what's setting in, the amount of hours they have to put in, and then next day they have to come back again despite putting the PPE, and it's not easy to work in PPE. People
Yeah.
try to put masks for 10-15 minutes. They should think in nurses, ICU nurses shoes. They have to wear the gowns and the N95 and the respirator and the headgear. It's very difficult to keep that on and then come back again, and as you said, see the deaths and young people dying, and it's very, very difficult time for healthcare workers of all kinds, and kudos to them, and they are real heroes. So let's just share a few tips what I learned, which can help people. First is recognizing if you're a healthcare worker, a teacher, essential worker, to recognize that you have either having burnt out, or you're going through anxiety or depression. It could be all normal. It could be, you need to recognize that you're going through that. So if you're getting more moody, tempered, bad tempered, you got to recognize that and then seek attention, because you're not made of steel. Though you shown that you're a superhero, but still, you got to let it out and recognize that you need to be strong again to help the society. So the tree gives shade, but if the tree does not take care of its own nutrition, how is it going to help the people who are using its shade? So the healthcare workers needs to recognize that they are right now, if they are having difficulty coping, difficulty concentrating, difficulty holding relationships, they need to seek help, mental health. Tips which I give to all my patients, and I have a lot of nurses as my patients, is to take a break. I know they feel guilty that but don't feel guilty. You got to sustain it, because it's not over yet. So you got to take a break. You got to recharge your batteries. Spend time with your family. Give them a hug every day. That's what got us through, is our near and dear ones. So having a support system is very important. So take some time off. Now more and more places are opening up, and if you are vaccinated and you go to more outdoor spaces, it's safe. So take time off, go to outdoor spaces. The other thing I tell patients, not patients, but let's say healthcare essential workers, anyone who's suffering from stress, anxiety, people even working at home, any field, it's very difficult to separate your home environment from your work environment. So you don't have that buffer. Let's say you have 9 to 5 job, and you close the doors in your office and 5 o'clock, and you're in your car. Suddenly your brain shuts off, and it's not thinking about work. But now working from home, though it sounds like it's much more relaxed, but it's very hard because there's no boundaries. So that makes it even harder. And as you were pointing out, your employees had a hard time working from home. And some people adapt. Some people, it's very hard to adapt to not having boundaries. And kids are running around; they can't focus on the job, and they're constantly feeling the stress that they need to prove to the organization that they are at work. So they get extra stress because of that. So recognizing it very important that you're getting burned out. Taking time off is very important. Spending time with your loved ones is very important. Pursuing hobbies other than work is very important. And then if you need to get help, mental help in terms of psychology, psychiatry, primary care, there should not be any stigma. It's a serious situation we all went through, as you said, PTSD, absolutely. So there are a lot of different cognitive behavior therapy without medications you can offer to these people. But lifestyle changes. And one thing, I was doing a talk yesterday about the link of food and mood. Both rhyme, food and mood, but there is a link too. If you eat Mediterranean diet, and then eat more whole grains, more rainbow kind of diet, and less fast foods like McDonald's and Burger Kings, and cook from scratch, less processed food, it has a direct relationship with lifting up your mood. So, if people say, I eat the comfort food like ice cream or cookies, it may give you a temporary increase in your improvement in your mood, but then you get a crash, and that's not good for your long-term health. So Mediterranean diet has been linked with a lot of good effects on the mood. And then the other piece is exercise. It gives you endorphins. The CDC recommendation of 150 minutes a week of any kind of exercise. Could be swimming, could be biking, could be walking, could be just playing ball with your kids, involving the family, involving your loved ones in the activities is good. It helps you both ways, build memories, build bonds, plus you can sustain it, you can push each other. So that's a very simple and effective way of getting out. Getting out is important. So if you're given a choice doing a treadmill at home, unless it's raining like it was earlier, but if it's not raining, go it outdoors and do it outdoors. Nature has a very therapeutic effect on resetting our emotions and helping us recharge our batteries. So take time off, folks. Take care of yourself, and we'll survive this. We are very tenacious as human species, and we'll do well. But we just need to help each other with getting vaccinated and look out for each other. If you see one of your friends, his colleague is not doing well, approach them and say, hey, maybe it's time to get help. It's not that you are intruding on someone, but you're trying to prevent serious depression or serious suicide or something, God forbid, in those times. So it's important to recognize that your loved ones or colleague is going through a tough time, and help them. Do you have anything else to add, Parul?
No, I think you covered it all. Healthy.
Yeah, go ahead.
Healthy food, healthy food, good lifestyle, positive thoughts, and empowering everyone, as a community in this tough time is all what we can do, I guess.
Right. And the other two pieces I didn't mention, and I want to add that, and this data driven is good sleep. If you have good sleep, so you should set time and make sure the room is dark and room is quiet. This will help you with your mood. So recovery is very important, and sleep deprivation lead to more depression and anxiety and panic and lack of performance, and that is a vicious cycle. So sleep is critical. And then the last piece you touched a little bit is yoga and breathing exercises, which I'm a big fan of. Will help you. Meditation is another uh, great tool to help you get centered and live in the present. So if you can incorporate those habits on as a routine, good food and exercise, and dedicate your time throughout the day, even you're busy, take the lunchtime out and take a walk around your office. So whatever you can do to incorporate in your daily routine, and stretching is good. So anything and everything in that line, and be very protective about your leisure time. I think leisure is something which is acquired, and you should be very protective about that. Will help you prevent burnout, and be passionate about what you do. If you're not happy that is not for you, then get out and find something else. I think that's another thing is important to do. All right, so we got a couple of comments. Let's address those. Loretta is saying, hello, Dr. and Ms. Garg. We appreciate what you do. Thank you, Loretta, for watching. That was very kind of you to participate. We're going to wrap up, Parul. Anything else? Last piece of pearls of wisdom?
No, I guess we thank you to all our listeners and all the patients. Good luck, everyone.
Right. So thank you, Parul, for coming in and adding so much knowledge to our patients about technology and how to use it. And I appreciate Jen and Debbie demonstrating all the platforms so beautifully as well. And till next month, we're going to take leave from you guys. Thank you, Parul, again.
Thank you, Dr. Martin.
All right. So let's wrap up the show, folks. If you have any questions, comment, please like our webcast and give us suggestion if you want any other topics covered. And please visit our YouTube channel and like that too. And I do appreciate you constantly giving us encouragement to continue with this show we started during COVID time, and that's very kind of you to keep encouraging. So give us likes and thumbs up, and put some comments up below there. And with that, namaste, ciao, good luck.